Naitwa Junior Joseph Marandu, nina miaka 12, nasoma katika shule ya msingi Majengo, niko darasa la 7. Nipo katika mradi wa Fit for School na nipo katika klabu ya Swash. Naufahamu mradi huu kwa kuwa ulianza hapa shuleni kwetu mwaka 2015. Na shughuli tunazofanya katika mradi huu ni kujaza maji katika ndoo na kuosha vifaa vya kujazia maji. Pia tunahamasisha wanafunzi wenzetu jinsi ya kunawa mikono kutumia sabuni kwa kufuata hatua 7 za kunawa mikono ili kupunguza magonjwa ya maambukizi. Kabla ya mradi huu kuja, kulikuwa hamna elimu ya kuwafanya wanafunzi waweze kunawa mikono na kupunguza magonjwa. Lakini magonjwa walikuwa wanapata magonjwa maambukizi kama vile ya tumbo, kwa sababu baada ya kutoka chooni wananawa mikono. Lakini baada ya mradi huu kuja, watu wakitoka chooni wananawa mikono, na pia wakichafuka kidogo wananawa mikono, na kabla ya kula wananawa mikono, na pia saa wakitoka kwenye usafi wananawa mikono, wanapunguza magonjwa ya maambukizi. Nafurahi sana kuwa na mradi huu shuleni kwa sababu tunapunguza magonjwa ya mlipuko, na pia walimu wanatupa elimu jinsi ya kunawa mikono na kupunguza magonjwa ya mlipuko. Na pia tunahamasisha na wanafunzi wetu waingie kwenye klabu ili wajifunze hatua zote za kunawa mikono, na pia wahamasishe na wadogo zetu pia wajue kunawa mikono. Hata huko tukienda nyumbani tunafundisha na wenzetu kunawa mikono.
The effective African extended family and community care system is threatened with destruction with the impact of the AIDS orphans crisis adding to other pressures. This could have disastrous results in terms of many uncared for children and all development aims reversed. I started the charity Care Africa Network, CAN, some 10 years ago in an attempt to address these issues. Based on research by CAN in Lesotho, Swaziland, Kenya and Uganda into innovative and effective methods, CAN has devised a training course on methods of meeting the needs of orphans and vulnerable children in Africa by empowering community-supported family care. It now offers this as a 2-day workshop of lectures and group exercises, accompanied by a 100-page manual with the purpose of transferring the knowledge it has gained from its research to those who have the opportunity to apply the methods and ideas to benefit more children in need. The concern in these countries that many children were traumatized, often as a result of the deaths of their parents due to AIDS, led to a request that CAN also provide a training course in the treatment of post-traumatic stress disorder in children. So CAN now offers a 2-day training workshop in the theory and practice of an effective patented method of treating post-traumatic stress disorder in children called Children's Accelerated Trauma Therapy, which I have a license to teach. Both workshops are accompanied by comprehensive PowerPoint presentations and printed manuals that can be retained by the students for future reference. Assisted by funding from Festival Medical Services, CAN provided these training courses in 2015 to all of 26 government district social workers in Lesotho and to 29 NGO and nurses in Swaziland, now Eswatini. In 2016, the courses were given to 4th-year social work students at the National University of Lesotho, where 58 were trained in the treatment of post-traumatic stress disorder and 75 in CAN methods, as were 32 government and NGO teachers, nurses and youth mentors in Eswatini. Feedback for the 4 components of the courses, content, presentations, handouts and group work, was between good and excellent in 2015 and between very good and excellent and nearer to excellent in 2016. The plans made by the students in these workshops for projects they would undertake were exciting. In 2018, using a further generous grant from FMS, we again focused our training on the National University of Lesotho, where 58 final year social work students engaged on both workshops. The training was also provided to 11 youth mentors in our partnership NGO in Eswatini. Contact was also established with 2 faculties of the National University of Eswatini. Feedback scores on the 4 aspects of each course, content, presentations, exercises and handouts, by youth mentors was between good and excellent. The university students scored these aspects even more highly, as between very good and excellent, 91 and 98%, and commended the courses highly. The university's staff were particularly complimentary about the courses and asked that they were taught again in following years. The students found the group work planning their own projects in the CAN Methods course especially inspiring. They were particularly enthusiastic about the courses and how they'd empowered them to help children and were determined to develop their own projects based on the ideas learned. This has reinforced our view that the university courses may be the most effective way of enabling children to benefit from the training we offer, since they will be best placed to promote the community care methods found beneficial elsewhere, as well as making effective treatment available to traumatised children. Accordingly, in February and March 2019, we have agreed we will provide both of the 2 courses to 74th year students studying for the bachelor's degree in social work at the National University of Lesotho. And at the National University of Eswatini, we will run the workshop for 74th year social work undergraduates at the Department of Social Science, and then for 30 final year psychiatric nursing student undergraduates at the Department of Community Health. We've asked that the university if they would allow relevant NGO or government staff to join the courses in addition, so as to encourage the interaction between the experience of the practitioners and the academic training of the students. This might also provide employment opportunities for the students and offer prospects of future joint projects between students and professional staff. Our target in February and March 2019, therefore, is to train up to a total of 230 new CAN extension workers in Lesotho and Eswatini. We hope that many will use their skills they gain to develop their own projects for empowering good community-supported family-based care of orphans and vulnerable children, and in the treatment of children suffering from post-traumatic stress disorder. These are 2 of the poorest countries in the world that suffer from the highest incidence of AIDS and its consequence of so many orphan children. In future, we'll endeavour to meet the demand for these courses in these countries. We should also like to offer the courses in other countries in Africa and use the opportunity this will create to update the course information about methods that are successful, as well as looking into possible avenues for CAN extension workers who have developed their own projects for children. Thank you so much, all of you in FMS, for your recent generous grant, which is making the work planned for 2019 possible. Thank you.
Hypertension is a huge problem in Zanzibar. And that is because if you go to OPD in all Zanzibar hospitals, PHC units, and even in Nazi Moja, you'll see the number of hypertension cases is high. It's big compared to other problems. So hypertension is a very, very big problem in Zanzibar. And if you look on the South District or Makunduchi per se, hypertension is also huge. At Makunduchi, we are having a clinic once a week, which is Tuesday, and the number of patients attending the clinic is big compared to other diseases or other problems. And it's about 200 and something a month coming down for the visit at the clinic every month, just for hypertension.
Hi, my name's Carla and I'm one of the HIPS volunteers. Over my 6 months working in Zanzibar, I worked closely with the staff in the hypertension clinic. We focused on 3 key areas, which were standardising patient care, improving patient flow through the clinic, and increasing accuracy of documentation. We were able to produce posters which were used by clinicians to guide them on how to conduct the clinic. This allowed them to provide consistent messaging to patients, and it also provided guidance on when to escalate management and what medication to reach for. In addition to this, we were able to provide education sessions for all of the staff that were rotating through the clinic on how to use those posters and also how the clinic structure worked. We also were able to reallocate human resources and also procure equipment, which allowed us to provide more thorough assessments and examinations of each of the patients. This included taking a blood pressure, measuring a patient's height and weight, and thereby being able to calculate their BMI. Through improving the patient flow and also having better human resources allocated to the clinic, the clinician was able to spend more time with each patient. We overall were very pleased with the progress that the hypertension clinic made and felt like the quality of care that was being provided improved greatly over that 6 months. I would just like to take the opportunity to thank you for all of the support that you've provided in allowing that to happen.
Hi, my name's Lindsay and I'm one of the current HIPS doctors volunteering in Zanzibar at the moment. Thanks to Festival Medical Services, HIPS has done a great deal for mental health services on the island. In 2014 we set up a clinic in Makunduchi Hospital in the south, where previously there were no mental health services at all and people had to travel into Stone Town in order to access any services. So a nurse was trained up, a local nurse working at the hospital, and we used the WHO's Mental Health Gap Action Programme manual. So with the help of that and ongoing input from volunteer doctors like me, the clinic's running really successfully and independently, and patients have been very satisfied with the service, as evidenced by a patient satisfaction questionnaire recently, which showed an overwhelmingly positive response, and a lot of patients saying that the clinic had really positively impacted on their lives. We also set up a clinic in Kivunge Hospital in the north of the island, where we're also seeing lots of patients. So patients come with problems like depression, anxiety, psychosis, and even epilepsy, which is seen in Zanzibar as a mental health problem. So both clinics are providing a really helpful service to the local population, and we hope to continue increasing our patient numbers because we feel that there are probably plenty more patients out there who might benefit from our services. So we've run a couple of outreach programs in the north and in the south, visiting primary healthcare units and spreading the word about the services available to try and reach people who might be in need of support. We've also been working on the supply of medication to the clinic, which is one of the ways in which we treat people, but not the only way. The supply from the government of drugs is often very intermittent because of problems with funding, and so patients will stop and start their medication because they can't afford to buy in private hospitals, in private pharmacies outside the hospital. So we've bought a batch of medication which we are helping the hospitals to sell at cost price, which is a sustainable model because patients will pay for the medication at a minimal price, and then that money will be used to buy a new batch of medication, and then the scheme can go on. The prices that patients pay will be much lower than that they would get outside the hospital in the private pharmacies, and so it makes taking medication daily a much more affordable thing, because unfortunately at the moment free medication is not always available. When it is, patients have it for free, and when it's not, the hospital will sell it at cost price. So we hope to continue our good work in Zanzibar with mental health services, and hope to continue expanding and improving our clinics with the help of funding from people like Festival Medical Services.
Okay, in Makumbuji we have a psychiatric clinic. We help them, the patient with mental illness. Some of them depression, anxiety, but most of them is epilepsy. Epilepsy, the patient is a major problem in our district. We help them by using WHO guideline. The clinic is very good. We have some people or some trainers who in our clinic.
Asante.
The integrated approach is one of the hallmarks of how Maternity Worldwide is improving maternal and newborn health. The determinants of maternal mortality can be thought of as 3 delays in terms of actually getting the right care. The delay in the women seeking care through lack of knowledge, the delay in women being able to access care. This may be because of the expense, or the transport isn't available, or the road conditions, particularly in rainy season. And then the third delay is the delay in actually receiving adequate healthcare once they are able to get to a healthcare facility. So despite having knowledge, despite actually getting to a health facility, often the resources are inadequate, so there may not be drugs available, there may not be equipment or equipment that's working, or the staff may not be trained to provide the care that the women need.
These are midwives who are qualified, but because of reduced practical experience during training, they may not have the confidence and the competence to work independently in rural areas. Therefore, our 3-pronged approach includes the training of skilled birth attendants.
The trainings that Maternity Worldwide is providing, very useful. Nurse midwives, they were taught how to give woman-friendly care services, and dignity and respect is among the principles of that care. The nurses feel also supported.
Maternity Worldwide, they bake cakes into the muffins for midwives, and it's this fund that are helping us as midwives to train us. I just want to thank the Maternity Worldwide because they have changed my life. There are some high-risk cases that I was not able to do. In previous, we used it to depend on other professionals like the clinicians. So now we're able to do these procedures with a minimum supervision.
We also have been focusing on looking at how the referral system works between small facilities in the rural area and district hospital. It is Maternity Worldwide's belief that strengthening Perimeter Community Hospital as a referral hospital for other rural areas will ensure that women are sent to the appropriate hospital for the needs that they have. The battle against unnecessary death in childbirth cannot be won by one action. It needs collaborative working, peer-led work at village level, interventions that are intensive, but they are championed close to where the challenges are, continued support for the isolated workers at rural facilities through continuing professional development and mentorship to ensure that their skills are always best practice and that they are able to manage the pressure that they work under.
The beautiful tribal villages are situated in between the dense forests of Pakhanjur Tehsil, Kanker district of Chhattisgarh. Between the scenery of forest there is a painful cry of the pregnant woman, child and tribal peoples. This is an undisputed phenomenon over the year. These tribal people are inaccessible to public transport. The construction of the road is prohibited due to an environmental revolution. Due to the bad condition of the road, it is very difficult to reach immediately at the time of critical situation of the patient. Tulsi Education and Kalyan Samiti, implemented with the support of FMS, provides health benefits to the tribal and needy people through several health projects. In the rainy season, it is very dangerous traveling even in a four-wheel vehicle in this unconstructed river-based road because all the rivers become overflow by the rainwater. In this situation, it is quite impossible to communicate with the tribal people. After a lot of difficulties, when our team reaches to the tribal areas, there begins one more problem. That is, initially it was very difficult to give treatment to the Adivasi peoples due to the blind faith of Adivasi traditional culture. They did not want to take treatment from our doctors. They hesitated to avail our health services. Actually, they only believe on tantric, means occultist. They used to go to the occultist for treatment of fever, stomach ache, skin diseases, even for the snake bite also they prefer to go to the occultist. Our Dr. Devashish and Nimai visits the tribal villages as a daily routine under the tribal health care program. Under the tribal health care program, our doctor and health team travels place to place to provide health services to the tribal peoples. Our whole team regularly arrange medical camps, mother and baby program to convince them and to create awareness about the health and hygienic. the medical camp project, including tribal healthcare program, brings confidence and peace to its services to the elderly, children, pregnant women and tribal communities. As per the requirement, we used to give the ambulance service for the referral patients. Our ambulance service unit in critical situation has taken different cases to the nearby hospitals for delivery, blood transfusion, etc. Some big doctors of Raipur hospitals, they are very impressed by knowing about our health service for the tribal people. So they regularly keep in contact with Sri Uttam Das ji and Sri Vishnu Das ji. Due to this goodwill, whenever our referral patient admit to those hospital, they give a good treatment in less amount. Over the period of time waste on the sincere several medical services by the Tulsi Education and Kalyan Samiti, the tribal people started using our medical services without any hesitation. These days, the tribal people used to call our ambulance service unit. It is a great achievement for our trust and for our whole team to provide health service to the backward areas. This all become possible due to the great unbelievable support of FMS.
Hello, I'm Sue Curran from the Cambang Trust. We're a charity working in the Gambia in West Africa, providing funding for education and healthcare in a small rural village. Our clinic is the regional centre for a monthly anti- and postnatal clinic. This also provides routine vaccinations and HIV testing. If you were here last year, you may remember that we've begun a process of trying to establish a setup whereby the school and the clinic are sustainable into the future without our financial input. This is inevitably a precarious journey, but for several reasons the timing feels right. Firstly, at the end of 2017, a new nurse midwife took on the management of the clinic. He's called Sylvester and is the perfect person to be steering this transition. His leadership has been transformative for the clinic. He has clarity and vision and an ability to think ahead and plan the future, which is a rare quality among Gambians. When we began this project 16 or 17 years ago, the majority of the villagers made a living through subsistence farming. Very few of them had had any education. So although our approach was very hands-off in terms of the day-to-day running of the school and the clinic, it needed to be almost the opposite in terms of planning and financing, because the local management committees just didn't have the necessary skills. Since the coming of a tarmac road about 3 years ago, many wealthier, educated professional people are building homes and settling in the village. Sylvester is managing to involve some of these newcomers who have the skills to really address the sustainability challenges. They've formed an association to support and work alongside the existing management committee. The first project that's been set up to generate income is screening football matches. An old store has been converted and the equipment bought and set up to show matches from all over the world most days of the week. They're also showing films for children at weekends. Although the income from this will never completely cover salaries, it is a really good start. Although I have to confess that watching 3 football matches simultaneously is just beyond me. A big focus for the clinic this year has been a malaria prevention programme. Your funding went towards regular training days and also providing over 400 bed nets for the most vulnerable in the village. Sylvester organised regular grass cutting in every area of the village in order to reduce the mosquito habitat. He's involved the local community in taking care of the clinic garden, which is another source of income for the clinic. Your contribution last year also went towards paying salaries, making well repairs, building new toilets in the school, and providing a healthy daily meal for all the children. Looking back at these photos from the early years of our project, I realised that some of these children now have children themselves. So the lives of a whole generation have been affected by the education and health care that you've supported us in providing. Thank you, FMS, from us, the Cambang Trust, but most especially from the people of Bakary Sambuya in the Gambia.
We Hear You is a cancer counselling charity that offers free professional counselling to anyone affected by cancer. It's very important when you are experiencing these conditions to have a place where you can talk to somebody, express your feelings and emotions and know that you're not going to be judged. A diagnosis of cancer is a bit like throwing a pebble into a pond. It makes a splash, but it also makes lots of ripples. The experiences that people have can be very difficult, and we provide a safe space for them to express their emotions. They lose control in the sense that they go into this regime of treatment. They may have to give up work. People may have to become carers.
I had the initial diagnosis and then all the treatments, which lasted about 6 months. And then as far as everyone around was concerned, obviously, that, you know, successfully treated. Everyone else around you is getting back on with their lives and thinking it's all fine now. Actually, for me, it wasn't.
For a lot of people, the end of a treatment is a real crisis. They expect to feel great. The hospital says, well done, go get back to normal, and they suddenly realise that they've no idea what normal is. What we provide is somebody who isn't connected to you to be able to talk through those emotions and those feelings, knowing that it's an emotion and it's okay to feel that emotion.
I tried 2-3 different counsellors, and they didn't really have an understanding of the effects of cancer on you emotionally. And also you're trying to deal with having it, but all at the same time you're trying to maintain your relationships with your husband, your sister, your children, so you can't really talk to them about how you're feeling because you're trying to maintain those relationships. And then when I found why, and it was somebody I could talk to where I didn't have to worry about maintaining that relationship or how they would feel, I could just say whatever I felt.
It can be very scary for people to think that this thing's been happening in their body that they have no idea about. If you were to come along for counselling, it would be a weekly appointment. It's the same time, same place, with the same counsellor. And we really want to make sure that the emotional support that we provide is available to anyone and everyone who needs it. So in the last year we have developed online counselling, and this has been great for reaching people who may be unable to travel, and also if they can fit it in around their other commitments. We know that the service we provide is not only very well needed, but we have really good feedback. We evaluate our service, and the evaluation that we do shows very clearly that it makes a massive difference. But what we need is more resources to be able to offer more sessions. We use counselling services free to those who would like to use it. We offer 80 sessions a week and around about 3,000 sessions a year, and we support children, young people and adults affected by cancer and life-threatening conditions. We're always looking at new innovative ways of generating income. So this year we have opened a charity shop with a difference called The Good Gallery, and it's based in Frome. Our shop sells local artists' wares. It ranges from jewellery to paintings to pottery. I think it's a really lovely concept of working with local community, with local artists, and also any money raised in that shop, the commission comes back to We Hear You. Without an organisation like Why, I think there'd be many more people deeply affected by cancer and with nowhere else to turn. What we need for more people to know about our service, because there are a lot of people out there who are affected by cancer, who need the kind of support that we can offer, but don't know that we exist.
Why is unique because of their understanding of cancer and the impact it has not only on the patient, but also on all of the family members. And I haven't found that anywhere else.
Hi, I'm Yvonne Newman, founder of Vital, working to eradicate child poverty in Calcutta. In October 2017, Vital opened the Southern Monday Clinic in rural Anirban, where the nearest hospital is expensive and over an hour's drive away. The Blindness Eradication Project is based on equipping and funding the eye outpatient department, the weekly cabs and the mobile medical unit, which deal with refractive errors, cataracts and vision problems.
India has 9 million blind people living in it. And out of these 9 million blind people, 65 to 70% of the blindness is avoidable. That is, if we provide them with the glass, they can see better. So all we just need to do is come here, diagnose them, take the pictures of the eyes, that they are right or wrong, they're doing good or not, and then we dispense the glasses. This is our part, but if you look into the part of the patients, what happens is their daily productivity is reduced. Say at the age of 40, a mother runs a family by just stitching few cloth or something, and then she gets the amount and then she runs the family. But as she crosses 40, she'll have problem with the near vision, where she'll not be able to put the thread into the needle. So what does this cost them? What costs them is the productivity is reduced and the income that they do is reduced gradually. So if you come and if you do a refraction and we just provide them with the glasses, the presbyopia is cured, we can again come back to the productivity. If a patient with cataract comes to me and tells that they cannot see the person coming from the far, they see blurred, all they need is just a removal of the cataract, and with modern day technology it is very possible and it's not a humongous task. So we have to bring more places like this, because the machineries that we have and the way we are checking it is actually helping people to improve the lifestyle that we do. Most of the poor people is devoid of the services that the people in the cities get, and it is not possible for them to go to the cities and do it, because maximum people out here lives in daily wages. So when I tell them that to go to the city and do their refraction or do their checkup just to get their glasses, they have to spare that whole time for one day where the daily wage will be lost. They will be also carrying their wife or the children, where increased costs will be added in it. So at the end of the day, they lose 2 to 3 days of wages. So we need to stop this and we need to reach them if they cannot reach us.
Between November 24th and January 30th, we have held 10 eye camps, helping us to achieve the 3rd UN Sustainable Development Goal, good health and well-being, while maintaining a focus on women and children.
Even though we get very good surgeons, even though if we get very good optometrists, they are helpless without very good technology. And when you need to provide them with technology, there comes a humongous amount of money that you need to spend on it. So if we can reduce the cost of the medical experience by reducing tax, by regulating it, we can reach more people.
আমার নাম রূপা মণ্ডল, আমি এখানে চোখ দেখাতে এসেছি। আমার চোখের প্রবলেমে কাছে জিনিস দেখতে পাই না, আর বললেন ডাক্তারবাবু ওষুধ দিয়েছেন 1 মাসের ড্রপ, দিনে 4 বার 1 ফোঁটা করে, আর চশমা দিয়েছে এটা পড়ার জন্য বলেছে।
If I talk about the eye, the ratio of ophthalmologist to the patient is 1:90,000. So if I tell one ophthalmologist to see 90,000 patients in his whole area, it is not possible. All they need is just the proper diagnosis and a comprehensive eye testing to understand what they are going through. And if they are basic checkups, BP, sugar, ECG, this can diagnose a lot of problems that they have. If you go to the hospitals, which is made by a government is doing their bit. They are doing a lot. But you cannot do a lot with such a huge population. So if we can reach the population in a fragmented way by increasing societies like this, by increasing clinics like this, then it is more better for them to serve. with the daily life, and it's also more better for us to provide the healthcare.
Within 5 years of full funding and through subsidised medicines to those living below the poverty line through the pharmacy, we expect the clinic project to become self-sustainable. In just 10 weeks, 732 women, 355 men and 270 children benefited from the project. Your support has improved the lives of thousands of people. Thank you so much.
Come and sing, together we can turn it back. If we all sing, together we can bring it back, and all the shades of life come flooding back. I am losing family. They were heroes, they were life to me, yeah. Why do blameless people die? And take the bullet for those who don't comply. Will a savior come today? Bring the blue, the war had turned to grey. Will the daughter of a soul? Together we can bring it back, and all the shades of life come flooding back.
We thank all of them and thank you for their help, and may God bless them.
I want to thank the wishers for the support that they have taken against St. Peter's Preparatory and for paying our school fees, managing that we are now safe, we are getting all the needs.
Thank you very much. May we take our regards and best wishes to all our friends and well wishers. Thank you.
Asante sana.
Welcome to the Good News Hospital here in Mandritsara. I'm Matt. I head up the Friends of Mandritsara missionary team working here. Madagascar is an island that lies 400 kilometres off the southeastern coast of Africa, twice the size of Great Britain, with a population of 26 million. Two of the major features of life in Madagascar are rice and cattle. Many Malagasy people eat rice 3 times a day and are reliant on their annual rice harvest to supply the needs of the family throughout the year. Oxen are seen throughout Madagascar, and it is not unusual to see them walking along the streets of towns and cities, as well as in the countryside. But oxen are worth a lot of money here in Madagascar, and cattle rustling is a common practice all over the island. Cattle are also sacrificed as offerings to spirits, and their skulls and horns displayed on wooden stakes. Many Malagasy people believe that the spirits of their dead ancestors control their fortunes in life, and so they worship their ancestral spirits. Mandritsara is a busy market town at the centre of a large rural area in northern Madagascar. It is the main town for the Simieti people, a group of almost 2 million people. The Good News Hospital began as a small outpatient clinic in 1995. It has now grown to a 57-bed hospital with 2 inpatient wards, 2 general operating theatres, a theatre for eye surgery, a maternity unit and physiotherapy department. The nearest hospital with surgical, laboratory and X-ray facilities is 200 kilometres away in the regional capital, so the Good News Hospital serves people across a wide geographical area. Here at the Good News Hospital, we have the privilege of being able to care for people's physical and spiritual needs. We strive to give excellent medical care, but we also want to ensure that everyone who comes to the hospital as a patient or as a family member will hear the good news of Jesus while they're here, and that they'll have an opportunity to respond. We do this because to those who follow him, Jesus offers life. The Friends of Mandritsara missionary team work alongside a team of around 180 Malagasy Christians serving God and the people of this region through the project. The hospital has developed over the last 20 years, and the number of patients continues to rise. We see around 20,000 outpatients each year. In addition to the outpatient consultations, we admit around 5,000 patients each year to our medical, surgical and maternity wards. There are gospel services held on each of these wards, both morning and evening, and staff members have many opportunities to share their faith and to pray with patients. Our surgeons undertake around 1,500 operations each year, and the surgical team offers to pray with every patient before their operation. The Voice of the Good News radio station broadcasts daily from early in the morning to late at night. There are gospel messages, Bible teaching, health education, programs for children and Christian music. The Good News School began in 1997 with 5 pupils. Today there are 12 classes and almost 350 pupils, aged from 3 to 15 years. All teaching is in French and includes Bible teaching. The Good News Hospital is a project of the Association of Bible Baptist Churches of Madagascar. We work in close collaboration with the local Baptist churches. The main local church is led by Pastor Julien and has grown to about 200 members, with 500 or more attending on a Sunday. In addition to the Bible Baptist churches in town, there are now around 70 villages where there are Bible Baptist church groups meeting regularly. But there is still much work to be done. Through the ministry of the Good News Hospital, we have many opportunities to reach out into areas yet unreached with the gospel. This work involves people across the world, as well as here in Mandritsara. Will you join us?